So Fergus, thank you so much. Please feel free to stay online. We're just going to have a couple of people come up who are part of the South Australian environment, just to a little bit of a response. I've invited 3 people to come up who've been part of this journey for over the years. But really what I wanted to recognise first is we purposefully chose to not talk about what's going on in South Australia. We know you're all doing amazing things. We know there's a bunch of people doing stuff here. And what we wanted to do was look outside of our borders, outside of our country, and then we can have a chance to come back inside and start thinking about what we can now do. Hopefully, this has contributed to your vision and realise that there is enormous opportunity. And I think the last presenter, Fergus, was able to say, you know, this stuff makes a difference. Well, we've got to bring the community along with us. So I think there's a whole lot of key messages, and we'll try to capture some of those and produce a bit of a communique that comes out of today, but we'll see how we go. But firstly, I've invited 3 people to come up and just a couple of minutes. They don't have to, no war and peace, but I might start with Maria. Would you mind coming up and making a couple of comments? And what Maria just said to me, where are the researchers? So I'll look forward to your comments, and here we are. We're on a journey.
Thanks very much, Wendy, and thanks to all the presenters. Obviously a very huge opportunity, and when Wendy asked me to talk, she said, well, if you can make some commentary about from the point of view of a researcher that's outside of the health system. So how many researchers here are actually not employees of SA Health? So just a few of us. Yes, so obviously a huge opportunity. We've heard a lot, and I'm thinking, well, there's huge opportunity. We need co-design with health. We need co-design with patients. We need obviously all the data protections. But where are the researchers who are actually going to be accessing or want to access the systems? And if I put the hat on that I've heard from all the researchers over the last little while, it's all about, well, the governance, and how do I get through the governance, and what's the training. And I've heard words here today that many researchers wouldn't have heard previously. So how do we actually bring our researchers also on the journey of actually being part of a trusted research environment, being able to access it and make the most of it, because that's what's actually going to be really important and impactful for health going forward. And I'm just sort of projecting forward around training, new roles, new responsibilities, costs, understanding how they need to apply for costs, what needs to go into their grants, the reviewers, governance systems, building trust and sharing for the researchers with a trusted environment, because researchers like to keep control of things because they want to see the best outcomes as well, but want to maintain control of their research. So they're just some thoughts about bringing the researchers along on the journey, which is an exciting journey, but they're the people that we're going to need to actually be able to do the work, particularly the ones that are interfacing with health.
And certainly Maria was talking about researchers outside the system, but we know there are many fantastic researchers inside the system, which is also a critical part of this journey. And I think it's how that actually interfaces with the researchers that are already in SA Health, because we know that they struggle as well. So, you know, this is not just about the people outside of the system, it's across the system, working out how do we get the best out of all of these elements, so that we really truly get a learning health system which thrives and the South Australian public get the benefit. So next one, with no further thing, is I'm going to ask Tina, who's just walked off the Camino. So I'm sure her head's in the right place to make a few comments. Tina has been really important in part of this journey for all of us, and has been part of the working group who helped set up today.
Thank you. And in Thank you. Okay, and in true style, I was taking my notes electronically, digital first. So thank you so much for the amazing speakers and to my colleagues who helped pull this all together, in particular Wendy, because I know there was a lot of thought that went into pulling the agenda together today. Really amazing speakers. The keywords I heard: trust, governance, flexibility and benefits. And let's not forget, yes, this is about research, but there's the public and patient at the centre of this too. How do we make sure we're bridging the gap between the research and research environments that were designed more for a public health and epidemiological perspective? That's the Camino coming in, not using words. But also the real world and the clinical setting and having an impact at that, patient-clinician interface, which is actually where we really want to make a difference. So we heard lots of different models, and we need to make sure we understand which models fit which use cases and which ones we actually need to solve, or the ones we want to solve as a priority. I was really comforted and inspired by the amount of progress and the number of initiatives moving forward, and recognition that TREs can unlock data access, but can also create new silos in a way. So actually, what are we doing about that, and the federated models as a way forward? That trade-off between the risks that we're trying to mitigate in keeping the data in a secure environment, but also what does that mean in terms of flexibility and ease of access and use? So if we lock it down too much, then actually do we make it harder for researchers and other people to access as well? I think that what I also heard, thank you so much for all of the legitimate theft offers. We will be knocking on your door very soon. Our challenge in South Australia: what use cases, if any, are the ones we want to progress TREs with, and what are the trade-offs we're willing to accept? We have shoulders to stand on, as demonstrated today, and that we can learn and steal from. And actually, we are the perfect place to do this in South Australia. We've got offers to partner, so thank you very much to the speakers who offered to partner with us. And we have huge opportunities within our state, not just a single electronic medical record, but we have SA pathology, and we have SA imaging, and a whole range of other things. We have the DAP, so we've got lots of things that we can leverage, and we also have an amazing project called the South Australian Comprehensive Cancer Network that we will be able to leverage to help move this forward as well. So we're very keen to support that. So yeah, really excited, and thank you so much.
And from my mind and the experience I've had over the last 7 years in this space is that we have to have a joined up solution, as opposed to everyone doing their own thing. Work out how to join it up, and if the federation is actually the way to do it, great. Our lucky last rapporteur is Josh, who wears a few hats these days. Well, he used to be a researcher, but anyway, jumped into the bear pit. Anyway, we'd love to hear your comments. Please introduce yourself.
Thanks. Yeah, Joshua Ross, Executive Director of Data Analytics and Insights in Commission. And Chief Data Officer, I guess, is the unofficial title.
So SA Health.
So, what does this mean for SA? So, I guess this Friday I'm on a panel at the Australasian College of Health and Service Management with the topic is, are we data rich and information poor? So what do we think? Are we data rich and information poor? I think we are at least definitely a long way from extracting all the information from the data we have. And I think Wendy alluded to, as well as James and even Fergus to some degree, about a learning health system, about using the data to inform, get information, use action, learn from that and improve. And I think what we need to do to enact that and empower that is to give more researchers access to our data. And this is where I think a trusted researcher environment that we've heard about today plays into that. So I guess the key things that came up today were about risks and trust. It's all about risks and trade-off and building trust. There is some legislation in there as well, which we have to stick to, but overall there's a risk trade-off. And I actually prefer the term secure access environments because I think we need to be looking at this with commercial partners in mind and a broader respect than just researchers as well, in terms of really making the most of the data we've got. So we're certainly, and we're a bit behind, unfortunately, in the TRE, progress, but I don't think that's a bad thing. So the reason we're certainly data rich is that we were early adopters of a statewide EMR, the only jurisdiction I know to have that, but that has come with some issues in terms of how good quality the EMR is. But what I think we learned today is that we could probably have the best fit-for-purpose TRE, or secure access environment. So we've now heard lots of different designs, lots of different possibilities, and it's up to us to work out what is best for the use cases we have and take the best parts of these. And I think the afternoon's been really valuable in that. If we look back at the aims, it was increase awareness, increase understanding, and shared some lessons from others, and hopefully that will inform system-wide design moving forward. So I think that's exactly what has been achieved here. The other bit I wanted to comment on was that working together and consistency and standards has been a bit of a theme from a number of the talks, and I think that's really important. I really embrace that. There's talk of federated TREs. There was also, Nicole made the point that standards and interoperability might actually remove the need for this, and we could move from a trusted research environment to a trusted execution environment where we just send scripts to be executed. I still think the TRE is a stepping stone there. It still provides and enables that in terms of creating a secure place to store data, an environment for execution, and it's about building that trust in the partnership with researchers and the commercial partner that this can help build. I think we should also look to try and be consistent and standardise nationally in terms of the training and accreditation that came up. And I really like the idea about the access, a researcher kind of passport that was available across this. So I'd like to thank Mike, Wendy and Health Transition SA and all the speakers today. I think we're really poised with a great opportunity here in SA to move forward in this space.
Thank you. Those three rapporteurs, that was actually better than I even anywhere near I expected. So thanks to the three of you. I really appreciate it, and I'm glad I put you on the spot. The one other thing I'd say before I hand over to Mike to wrap us up is that there is funding available if we actually look for it. Now, through the ARDC, we've heard a lot about them, and we've heard about their Trusted Research Environment project. South Australia, HTSA is the node for HASANDA clinical trials, and we're about to become the node for HASANDA cohort studies. We don't want to be the node for TREs, but what I'm saying is there is money around if we actually think strategically about how we work with these funders. And I think, Sash, you talked about you wanted to use the money that was out there. So I think we have to be creative with the money. And yes, we will need some South Australian money, but we probably can get some national money to get us on the journey. And I think the sooner we do that, the better. And we bring in the boys and girls from ARDC to actually have those conversations. So with that, I'm going to hand back to my co-chair, to Mike, to wrap us up, and just thank you all for coming, and thanks for staying to the end.
Well, we're almost at time. I won't prolong I was going to say agony, but I won't prolong this any further than I need to. I really do just want to thank the speakers for excellent presentations this afternoon. I just really want to thank yourselves as well for the input that you've given and for really taking an interest in this. And thirdly, and importantly, I really want to thank HTSA and LC for the work in kind of pulling all of this together, because I think it's been a really valuable step on the road. I think, as you said, Josh, we are behind, but I think this really, hopefully through events like this and conversations and bringing people together and collaboration, we really do have an opportunity to kind of move this forward at pace now. But anyway, thank you so much, and we'll see where this now takes us.